Hi everybody, welcome to today's video. It's Dr. Kestler from Lorain County Community College. First of all, it's the 14th of April, on one of those days one of the days that we don't go out at all. Let me tell you, my temperature today is 96 Fahrenheit, 35.6 Celsius. I want to talk about some weird kind of news and some things that are going on and how things are changed and how things are gonna change, because I'm thinking about the future right now. First of all, I just want to remind everybody to vote. There are ways of tracking your ballots and to see where they are. It is now 2 weeks from today that you have to get your vote postmarked, so you want to make sure that you get that in as soon as possible, and because voting is an important thing to do. So the first story here is an interesting one, and that is that the world's changed a little bit since since COVID-19. And one of the things is that the seismographs have gone quiet, because there's less rumbling, there's less moving around, there's less noise. I mean, I think if you walk outside, you can kind of feel the difference, that there's something different about it. And, that's going to change. I mean, previously we talked about pollution being way down, which is actually a good thing for COVID-19, because one of the comorbidities, one of the problems that you have, people are more susceptible if there is pollution and that kind of stuff going on. So that's one of the changes that has occurred. I want to talk a little bit about drug studies, there was a small drug study going on. I think it was in Brazil, where they halted the study because there was too much toxicity associated with it. There was a heart disease. I will tell you that most drug trials fail. I mean, for one reason or another, either it doesn't reach the right patient, or for some reason or other doesn't fail. There's about 200 clinical trials going on right now, and it would be great if one of those things worked, or a couple of those things worked, but there's just no guarantee that that will be the case. So we'll keep on hoping for a breakthrough in that regard. One of the things that I want to remind you, just touch my face. Got to go clean this hand in a minute. But one of the things I want to remind you of is, after this is all over, there will be some problems. There will be some long-term problems associated with this. And one of the things is that we're not vaccinating children. And that is especially a problem. We're not doing a lot of things right now. There's a lot of things, a lot of preventive health care we're not doing. And by not vaccinating children, that's kind of a serious issue, especially with a disease like measles. Of course, there's polio and other diseases, but measles is quite infectious, much more infectious than COVID-19. So that is something that we have to think about going forward in the future, and taking care of. I want to spend the rest of the time really talking about the mental health pandemic. Let me just use that word for the first time. We are going to have a lot of people, and I'm not just talking about the people in healthcare. Of course, the people in healthcare it's going to be a big deal for those folks in healthcare to go on. I am talking about all sorts of issues going forward. People who have lost loved ones, people who have seen some terrible things, the people who are working not just in healthcare but in working with the homeless. From what I understand, the homeless population is devastated right now, and there's going to be, it is nearly impossible to take that population and practice social distancing. That is just not a thing for that population. So we need to think about what we need to do going forward. There's going to be an awful lot of people who are going to have PTSD, post-traumatic stress syndrome disorder, and it's going to be, you're not going to know who they are. They're not going to really present. They have seen things that maybe are a little bit disturbing. So how can you help? Well, you can be a helper by listening to people. That is an important kind of thing to do. Validate their concerns. Don't dismiss. Don't trivialize their feelings, um, and support them and encourage them if necessary to seek professional help. So there's people who are working in healthcare. We just learned about people who there's an outbreak of COVID right now in a nursing home in North Ridgeville, and there have been other ones. There was one in Avon Lake a few days ago where there's an outbreak going on. There is going to be trauma for a lot of people. The people who lose loved ones, and who will be losing loved ones, and the people who are working while that's going on. A lot of people got drafted into a war that kind of just developed around them, and they're receiving battle scars right now. Some of them didn't make it. Some of them have passed on. Some brave people who were helping passed on, and so we have to be ready. For those of you in the professional helper role, those of you who are professionals, mental health professionals, get ready. This is a good time to, if you're not doing much right now, get some professional training, some extra professional training in PTSD and other kinds of problems that are going to be part of the future, that are going to be needed. We're going to need these skills so that you can help along in the future. So there's plenty of things that we can do to help, and even regular folks can figure out how to talk to people. All right, I'm just going to leave that right there today and say, be good to each other, and may you persist like a lentivirus. Thanks, and have a great day.